ACT is a form of cognitive behavioural therapy that has its roots in behavioural psychology, and it takes an approach towards human living and human suffering that bad, hard things are going to happen to people, and that often the things that we try to do when hard things happen in our lives tend to be of the form of trying reduce or control or avoid those kind of difficult things. And that paradoxically some of those responses that we have can make life harder to live.
Well, I find that when I work with people with MS, they often come to me and tell me about the difficulties they're experiencing and thoughts that sometimes come up because of that. And those thoughts are very accurate. So, for example, if someone's MS is quite active and progressing and they're finding that they're no longer able to maintain employment, for example, then they might be having thoughts like, I don't know if I can cope with this, I don't know if my partner can cope with this. And one of the ways they might respond to those thoughts is to retreat into themselves and to not talk to their partner about how difficult things are. And that can have the result of them actually feeling quite disconnected from one another, the person with MS feeling very isolated, and their relative, their spouse, feeling like, I just don't know how to help them. And so rather than challenging those thoughts and saying, you know, is it really accurate that you can't deal with MS? It's very understandable that at times people feel they can't deal with MS. But what do they do when those thoughts come up? Do they let those thoughts dictate what they do and for them to distance themselves from other people? Or do they actually try and notice when those thoughts come up and say, actually, they're not going to control what I do. I need to do what's right for me and for my family. And it's helping people to kind of shift their behavioural response to those thoughts so that it's much more helpful for them and those around them.
Well, if people watching this already have a background in using more traditional forms of cognitive behavioural therapy, they have a lot of the building blocks that they already need in terms of assessment of links between thoughts, feelings and behaviours. But really the thing to focus on is workability, in terms of, is the person that I'm working with's responses, are they working to help them to pursue a life that is meaningful and rich, even with multiple sclerosis? So one of the things that we do in ACT would be to help the person to make contact with what it is that matters to them, what they care about, what they would choose their life to be about if they got to choose. And we want to try and set goals that are in that direction of what we call values. And then instead of taking the stance of trying to challenge or modify thoughts, we're really trying to instead help people to work at noticing how when a thought or feeling that's difficult comes up, it takes them off course from their valued path. And what we want to try and do as therapists is try to help to kind of keep a focus on, can we still do things towards values, even in small steps, even with difficult thoughts and feelings. And so taking a stance that's more, okay, this is a difficult thing in life, and I'm willing to experience it in order to take steps towards things that matter to me in my life. So, for example, eyes closed exercises involving mindfulness, involving noticing the present moment, getting more in touch with what's happening here, now.
We often find that people end up doing what I sometimes call time travelling, where they spend a lot of time in the past thinking about how things used to be, and a lot of time in thinking about the future, often worrying about what might still come. And that kind of jumping forwards and backwards means that it's very difficult for people to get in touch with where they are in the present moment and what they really want this immediate moment and these next few hours and days to be about. And mindfulness is about trying to draw people's attention back to the present moment so that they're then more aware of what's going on, and then they can make kind of conscious choices about where they would like to go next.
We also, for example, extend those kinds of exercises. There's an example of an exercise called Leaves on a Stream, where we ask people to imagine that you're sitting on a bank of a river and that you can see leaves floating past. And then we get people to imagine if you could see your thoughts as if they were leaves floating past. And this is designed to create a separation between the person experiencing the thought and the thought itself, creating that little bit, just a little bit of distance, to then give someone more choice about how do I want to respond when that kind of thought or that kind of feeling comes up. And that kind of exercise is very much a part of that kind of mindfulness and acceptance kinds of exercises. We also would, for example, use a lot of metaphor. Metaphors work by giving explanations of psychological events and how things are happening, but not in such a kind of a verbal problem-solving kind of a way, much more in a kind of intuitive, analogical way that people can relate to and have kind of impact and influence.
I find that working with ACT, it's a very compassionate model to work with. It's very intuitively appealing to work with, and I think that people get a greater sense of self-acceptance. So one of the kind of exercises I use is that I imagine that their focus, their attention is like a torch in a dark room, and sometimes they feel like the light beam is very directed on MS. And what I sometimes do is try to work on people on kind of making that beam wider, and so getting in touch with other aspects of themselves again. For example, I also like horse riding, and I like walking my dog, and I really like going out for coffee with my friends. I like phoning my folks more often. And when people are focused on their whole self, MS, if you think about it like a pie chart, instead of MS, say, taking up 95% of who they see themselves as being, MS is one part of who they are. And when MS is less in people's face, they feel much more in touch with who they are and what they want their life to be about. And I find that people feel much more able to take even small steps forwards on the very difficult days when they've got this sense of MS as a part of who I am, but it's not me. And so that's one of the ways that I find it really helps my work with people.